Hello everyone, welcome to today's live webinar. Thank you for joining us today. I hope you can hear me loud and clear. I'm Michela Fassi, I'm Communication Manager at Milestone, and I'll be your moderator for today's webinar. Today we are here for our live webinar titled 7 Application Tips to Improve Your Decalcification Process. During this live webinar, we will discover the best practices of decalcification and how you can enhance this technique. Milestone has been in the field since 30 years. Our mission is to reduce patient anxiety by providing pathologists with technologies for same-day diagnostic results. Today, Milestone is proud to offer innovative solutions in 6 different fields: frozen section, cytology, sample handling, tissue processing, macrodigital, and reagents. Before we get started, I wish to inform you that Milestone organizes these type of webinars once a month. Next webinar will be on the 29th of October, and you can follow us on our LinkedIn or Facebook pages or on our website to stay tuned. Before we start, I kindly ask your attention for a few seconds. In the slide, you can see the main function of the WebEx platform through which we are broadcasting. Since this webinar is intended to be interactive, we encourage you to ask questions. You can submit questions anytime by typing them in the Q&A box, which is located in the right bottom part of your window. We will answer some questions at the end of the presentation, and for all questions that may not be answered live, we will reply by separate email. The slides will flow automatically during the webinar. If you have any technical problem in viewing or hearing the presentation, please write to the host in the chat box, and we will try to support you. You can also notice some little icons on the right upper corner of your screen. You can use them to adjust your screen display anytime during the webinar. We suggest the full screen visualization, especially during the demo from the lab. Now let's take a quick look at today's speaker. Our speaker today is Beatrice Gamba, Application Specialist Team Leader. Beatrice has a degree in medical biotechnologies and molecular medicine. She has been working in Milestone for 10 years, and she has acquired great experience with almost all the histological techniques, which she performs daily in Milestone laboratory. This presentation today will be recorded and will last about 45 minutes. Now it's definitely time to start, so Beatrice, you have the floor.
Hello everyone, I'm Beatrice Gamba. Today I'm here in the Milestone Pathology Lab to introduce you to the decalcification technique and to show you some important tips on how to optimize it. I will show you then directly from this lab all the Milestone solution to optimize and help you in the decalcification technique. Now, just give me a few seconds and I will share with you my presentation. Decalcification is a very common histological technique. Almost every anatomy lab has to perform it. But let's face it, it is also rather unpleasant since it distracts the personnel from the normal histological process, as it requires further processing and the use of acids, and it has a quite long duration. For these reasons, I went to study why decalcification is necessary and how can be properly performed. Let's start with some information on the bones. Bones are the major structural and supportive connective tissue of our body. They have a hard and rigid nature due to the inclusions of minerals in the osteoid matrix that gives strength and rigidity to the body. From the next images, you will understand immediately what I have explained in the last minutes. A picture is worth 1,000 words, I could say. The first image is just the human skeleton. The second image shows the structure that the skeleton supports. The third image represents how we would be like without a skeleton. There's no need for many other comments, I think. Bone consists of three major components. There are cells named osteocytes, and they are surrounded by a calcified matrix. And then the collagen fibers type 1. And now I'm going to reveal you which is our great enemy. Is hydroxyapatite. It's such an enemy that I have been trying to properly pronounce these words for 2 days, and really I cannot, as you can notice. Calcium, in the form of hydroxyapatite crystals, is located between the fibrous elements, and during the decalcification, we need to dissolve these crystals. Calcium interferes with the normal histologic process and prevents the normal sectioning of the blocks at the microtome. This is due to the difference in density between the calcium and the paraffin. It is perhaps easier now to understand why so much effort is required. The purpose of decalcification is to remove inorganic calcium from the matrix. Decalcification is performed after fixation, but before tissue processing. It ensures flexibility and facilitates tissue sectioning to easily undergo under pathological evaluation. Now, we finally move to the most interesting part of the presentation, where I will show you 7 application tips to improve your decalcification. The first application tip is fixation, fixation, and again, I repeat, fixation. Fixation is really a crucial step in the preparation of all histological specimens. If it is not carried out under optimal conditions, a tissue can be damaged, and the information coming from the samples will be totally compromised. Fixation preserves the cell and tissues in a lifelike state to allow preparation of stained slide. In order to protect the cellular and fibrous elements of bones from decalcification reagents, it's particularly important to properly fix, and I repeat, properly, the samples before decalcification. Poorly fixed specimens became macerated and stained poorly. From here, the importance for big bones to use a good quality saw and slice them into thin sections. Secondly, you absolutely need to use a good decalcifying reagent. The ideal one is the one that completely removes calcium without causing destruction and adverse staining. For convenience, most laboratories choose the many proprietary reagents available, but I suggest you to consult the safety datasheet to determine which is the real active component present. There are 2 main types of decalcifying reagent: acids and decalating one. When using acids, the calcium is dissolved through a chemical reaction. Acid can also be divided in 2 categories: the strong mineral like nitric and hydrochloric, that usually are used as a concentration less than 10%. They are rapid in action, but potentially dangerous, because if they are used for excessive time, they can cause loss of nuclear staining and macerate your tissues. If you use this type of reagents, you need to be very careful. There is to over-decalcify the tissue. The second category is the weak organic acids, such as the formic one, that is the most popular. Compared with the strong acids, it's slower, gentle, and it interferes less with the nuclear staining. It can be used as a simple 10% aqueous solution or combined with formalin or buffer. The second type of decalcifying reagent is the chelating one, such as EDTA, with a very different mechanism of action. They work by capturing calcium from surface of apatite crystals. The process is very slow and gentle, more appropriate for labs where very high quality is required, and molecular testing like immunohistochemistry, FISH, or PCR can be possible. Concentration used is usually from 10 to 14% as a neutralized solution, because the rate at which EDTA decalcifies is pH-based. For this reason, Milestone has developed the mold decalcifier reagent. Today, standard decalcifying reagents for histological application are made of 10% EDTA with the addition of an acid or base to bring the solution to the desired pH, 7.2 or 7.4. What is mold decalcifier? Milestone mold decalcifier is an enhanced decalcification solution of 10% EDTA by a Milestone proprietary mixture of EDTA salts. The combination results in an optimized pH of 7.2, 7.4, with no addition of any acids or buffer. Another simple but important factor influencing the decalcification is the agitation. Agitation increases the rate of every fresh reagent near the bone surface, because the removed calcium can saturate the solution around the tissue, preventing further decalcification and changing the concentration of the reagent close to the tissue surface. Therefore, it is extremely important not to carry out a static decalcification, as we are often used to do in a jar with the bones deposited on the bottom, as you can see in these pictures. On the contrary, the presence of a stirrer increases the excess of the fluid on the surface of the sample, enhancing diffusion and penetration. We will see later together in the practical demo that our Milestone units have built-in agitation in the rack or inside the cavity of the unit to ensure that the reagent is always fresh on the sample surface and at an homogeneous temperature. Time is money, as we know, but time can also be really dangerous when decalcification is performed. If the time is too long, the risk is over decalcification, with samples that are no longer recoverable, especially if you use strong acids. On the other hand, if the time is too short, there's a risk of under decalcification, with cutting and diagnostic problems. Anyway, I remind you that under-decalcification can always be recovered. We definitely need an automatic tool that calculates the time for us and draws our attention when we have to check the status of the decalcification process. We will discover later together in the practical part how our units can control the decalcification time with sound and notification when the required time is reached. The automatic units can also manage the discharge of the decalcification reagent by loading a maintenance solution. Together with time, temperature is also one of the key factors for decalcification. The use of a standardized temperature guarantees the same result in different environmental conditions, as the ambient temperature varies over the days and the seasons. Moreover, the use of a temperature even slightly above the standard guarantees shorter decalcification times. Temperature combined with chelating reagents such as mold decalcifiers shortens the normal decalcification times, making possible to decalcify within 1 day while using an optimal reagent for molecular biology. Again, in the practical part, we will see some units with decalcification temperature control and control of the maintenance of the preset temperature. In this slide, I have inserted the decalcification protocol that can be used with the mold decalcifier for 18-gauge bone marrow at 2 different temperatures, 37 and 50 degrees centigrade. As you can see, being the mechanisms of action slow leads to medium times, but also to a much higher quality of the analytical results. This is a great value, I believe, nowadays, where the target therapy based on molecular biology is becoming really important. From the tips we have seen so far, it's easy to understand that decalcifying a sample is a bit like following a cookie recipe. You need to use the correct ingredient, the reagent, you need to set the correct time and temperature to ensure standardization in execution regardless of the user. Once the recipe has been standardized, the documentation of the execution is essential to find the data relating to a decalcification. That's why I suggest you to have a tool which provides you with report activity of your process. With this regard, Milestone units provide the documentation required. It's possible to export reagents log, events log, and autosave the programs. All the above tips can be not 100% effective if you don't use the right instruments. The right tool is the one that allows you to control time, temperature, equipped with steering for agitation, with standardization and documentation of the protocol. Now, having those application tips in mind, we will see them applied in our lab with some instrument in action. The last thing I want to show you before moving into the lab is the important result that we can achieve by following our 7 application tips. In particular, this is the results of the standardization of fixation and decalcification using the mold decalcifier reagent and the bone station unit. This is a control multiplex PCR, amplification of different sized genomic segments harboring single copy genes on bone trephines performed in the Institute for Pathology of Berlin. It's easy to see the difference between sample 2, 4, and 6, decalcified with mold decalcifier in bone station, and those made with their decalcifier, homemade, and using the static manual method. Now, let's move in the Milestone lab to show you the decalcification solution that Milestone has developed. Please just give me a few seconds and I will move in the lab. Now we will see together in details some of the solutions that Milestone has developed to help you in the decalcification process. We will see here applied all the 7 tips that we just presented in the presentation. I would like to start with 2 units, the bone station and the decalmate. Let's start with the bone station. The bone station is a little unit, manual, that is dedicated to fixation and decalcification of different kinds of specimens. We can decalcify standard specimen in the standard cassette rack, medium specimen in the mega cassette rack, big specimen in the super mega cassette rack, and even really big bones in the dedicated rack. This rack is the internal divider. It can be used in 3 different ways. The first one is just with the positioning plate inside the glass container. In this case, it's possible to decalcify only 1 big bone. The second way is to use 1 vertical separator. In this case, it's possible to decalcify 2 big bones. The third way is to use the second vertical separator. In this way, it's possible to decalcify up to 4 big bones. I prepared here for you 4 bones to show you the real use of the internal divider. The bone station unit has 2 main positions of working. A back position only with steering without heating, and a front position with steering and heating. The ideal use of the bone station is to collect the specimen during the day in the back position inside the fixative. The specimen will be kept in fixative with steering. When all the specimen has been collected, we can move the fixation module in the front position to complete our fixation with time and temperature. For example, 1 hour at 37 degrees. Once the fixation is completed, we can move the rack in the decalcification solution. Between the fixative and the decalcifier, it's possible to perform a wash in a solution that is already in use in the lab. This solution can be, for example, water, ethanol 70, or any kind of solution that is already in use in the lab. For sure, the good positioning of the bone station is under a fume hood because you avoid to be exposed to formalin and decalcifier vapors. Now, we can start our decalcification in the front position with time and temperature. When the unit will reach the time of the decalcification, the unit will emit a sound. It's possible to check the decalcification status in this lateral part. So the idea is to take out the specimen, open the cassette, and check the status of the decalcification. If the decalcification is completed, the program can be completed and a run will be saved with all the data about the decalcification. If the decalcification needs to be prolonged, it's possible to extend the time of the decalcification, and the extended time will be automatically saved in the unit. In the bone station, being all the container made of glass, it's possible to use any kind of decalcification reagent. So, like the chelating one, mold decalcifier, to the strong one, nitric acid or hydrochloric acid. Now, we move to the second unit that I want to show you, is the decalmate. The decalmate can be considered the automatic evolution of the bone station, because as you can see, all the reagents are loaded in tanks, and the movement of the reagent is automatic from the tank to the cavity, where the samples are loaded. So no user intervention is needed to change the solution, and this allows you to have a really precise time of decalcification, because when the decalcification time is completed, automatically the unit will load a maintenance holding solution. Once the samples are in this solution, it's possible to open the cavity, put the cover in the dedicated area, and check the specimen in this lateral part of the unit. If the decalcification is completed, the process can be completed. Otherwise, if the decalcification needs to be prolonged, we can go back to the decalcification up to 3 times. All this decalcification will be saved from the unit in the save run. Decalmate uses the same rack that we saw for bone station, and like bone station can be used with any kind of decalcification reagents, such as chelating one and very strong. Being an automatic unit, such as the tissue processor maybe you are used to, it has a lot of safety sensors on it for the loading and unloading of the reagents, temperature sensor, and so on. The decalmate, every time you start the process, will ask you how many cassettes are you putting inside. And this is very important to check the quality of the reagents. Through a simple color coding icon status, we can understand if the reagents are good to go, so the color is green, are quite close to expiration, and the color is yellow, or needs to be replaced, and the color is red. Now, we move together to other 2 interesting units that I want to show you, COS and Logos J. The main difference between these 4 units is the kind of heating that we use. In all units, we use a kind of resistance conventional heating. In COS and Logos J, we use also a slow microwave heating. This allows us to have a slightly rapid decalcification rate because microwaves creates a movement inside the ions of the reagents. Then let's start with the COS. The COS is a really simple unit, but very, very interesting. Why? Because in COS, you can perform fixation and decalcification, but also another kind of application, such as spatial stain, antigen retrieval, or tissue processing up to 3 millimeters. What is really interesting in COS about decalcification is the number and the different kind of modules that we have available. We have modules for standard cassettes, mega cassettes, and super mega cassettes. And what is really innovative in COS is the multiple decalcification module. As you can see, in the multiple decalcification module, 8 different containers are separate, and they can host 8 different cassettes coming from 8 different patients. This was particularly developed for corpse analysis, where the unique DNA is really important for identification. So, being able to do the decalcification in 8 different compartments will allow you to avoid the cross-contamination of the specimens. COS, like the bone station, is a manual unit. So when you need to change the reagent, you need to be in front of the unit and change the solution where your sample are inserted. For sure, again, this must be done under a fume hood. Then you can continue your decalcification phase inside the unit. COS2 has the possibility to check the status of the bone and also to check the quality of the reagent, because it has an automatic counting of the cassettes that you are about to decalcify. Let's move to the Logos J, the last but not the least. Logos J is really innovative. It is a decalcifier and tissue processor, all in one. And I could say it's really something unique. It's the only unit that automatically can perform from fixation, decalcification, dehydration, clearing and embedding of your bone marrow. Ideally, you can use the Logos J in this way. At 5 p.m., when all your bone marrow have arrived in the lab, you can load them in the main cavity, and the decalcification will be performed. But not only, the tissue processing will be performed, so that in the morning, when you arrive in your lab, you will find your sample already decalcified and processed. Then you can take out your bone marrow and use the unit as a normal tissue processor for biopsies. Then, at 5 p.m., you can restart your bone marrow sample. Both decalcification and tissue processing can be done in 2 different racks. 48 cassettes rack or 42 cassettes rack that can be divided into halves. For decalcification, the limit is 5 millimeters. For tissue processing is 3 millimeters. Being a unit designed for bone marrow, it can only use soft reagents, such as the chelating one, like the mold decalcifier, or the weak one, such as the formic. I think that now is time to conclude and to sum up. We just saw together the importance of applying our 7 tips to optimize the decalcification. First of all, fixation. The first step, but really the most important. Second, choose the right decalcification reagents. And with this regard, I suggest you to use the chelating one, such as our mold decalcifier. Then, time and temperature. Time and temperature are really important to design the right protocol on your bone. It's like a cooking recipe, the same. Agitation. It seems to be very, very simple, but it's important to maintain reagent homogeneity and always fresh solution close to the bone. Then, standardization and documentation. They are 2 key factors to document your process to be able to report the decalcification activity. Now, with this, I conclude my explanation. I hope to have been clear for everybody. In any case, now I'm here for your question. Thank you.
Thank you, Beatrice, for your nice explanation. I have already received some questions, so let's read some. Anyway, if you have other questions, now it's the time to type them in the Q&A box. So first question, Beatrice, which is the biggest bone that I can decalcify in a bone station?
Okay. In bone station, the biggest bone that you can decalcify is using the internal divider without any vertical separator. So I will just insert the base plate in the glass container. And more or less, I can decalcify a bone of 13 centimeters per 8 centimeters. So I would say quite a big bone.
Okay, another question with regard of the different reagents that I could use for decalcification. Is there maybe any publication about it?
Yeah, we have a lot of publication regarding to the decalcification topic, and in particular, there's one where they compare different decalcification reagents coming from the chelating one up to the very strong one. They do the decalcification for the same time on different bone trephines, and then they go to analyze the quality and the quantity of DNA and RNA. And it's easy to see that the quality of DNA and RNA, if you use a chelating reagent, is higher than the use if you use the strong acid. Anyway, it's possible to find all publications on our website divided by topics.
Okay, another question now. Since you mentioned that Logos J also functions as a tissue processor, can you better explain this function, maybe in a few minutes?
Oh, absolutely, yes. Logos J, as we saw, is a unit for decalcification, but also for tissue processing. Why? Because in these tanks that you see, we have formalin, then 3 tanks dedicated to decalcification, and then dehydration and clearing reagents. Then Logos J is equipped with 2 cavities. One main cavity, where all the reagents for tissue processing are loaded, fixative, dehydration, and clearing reagent. and one paraffin cavity. We can work in the Logos J for tissue processing in two main ways. One that you suggest during the day is the dual mode. So I start my protocol in the main cavity, and when the dehydration and clearing phases are completed, I move manually the rack in the paraffin cavity, so that I can start a second run in the main cavity. This is to allow a continuous loading during the day. Then, what I suggested you before for the decalcification, before to go home, the second modality. You load the rack in the main cavity, and then is the paraffin that will be automatically moved in the main cavity. In the morning, you arrive, what you need to do is to download the paraffin, take out the rack, and perform the embedding of your specimen. Just to mention, now I explained in few minutes, but it's possible to ask me and all the application team for any virtual demos you might need on any application that we have in Milestone, such as tissue processing, decalcification, or frozen section. We are at your disposal.
Thank you, Beatrice. Now, let me share one final slide with you, because I see that time is running out, so we cannot read more questions, but for any question that have not been answered live, we will reply via separate email. So if you have any other question, if you wish to receive any material from us, please do not hesitate to contact us. As Beatrice told you, we are, of course, always available to organize virtual demos. Our application specialist will be happy to provide demonstrations, consultation, and solution through face-to-face conversation with live webcams. And you could virtually enter in our lab as you've seen today. If you wish to keep up to date with Milestone live events, we suggest to check our website and follow us on our social network. You'll find all the information about the future events there. And by the way, you can save the date for next live event, which will be on the 29th of October, with topic specimen handling. Registrations are open. This webinar will be available for on-demand reviewing starting from tomorrow, and you will receive an email message when the webinar is available for replay. Finally, we would like to thank you all for watching and participating today. Thank you for your great attendance, and we hope to see you all next time. Thank you and goodbye.
Bye-bye.